Hi, my name is Brian Apavu. I am a neurologist with an interest in philosophy, the mind, and living the examined life. Today, I want to dive into the condition known as self-limited epilepsy with autonomic seizures, currently called SeLEAS. It's an epilepsy condition we've heard in the past, and neurologists and epileptologists have referred to in the past as Panayiotopoulos Syndrome. So with SeLEAS, or Panayiotopoulos syndrome, this is what we consider a self-limited childhood onset focal epilepsy that's characterized by seizures with prominent autonomic symptoms, most notably vomiting, pallor, and autonomic disturbances. It is recognized by the International League Against Epilepsy as a self-limited epilepsy with autonomic features, and that's where it gets the acronym. The condition affects about 6 to 13% of children at ages of about 1 to 15 years of age who often present with non-febrile seizures. And the peak of onset typically is around 3 to 6 years of age. The seizures can be often prolonged, up to 30 minutes in up to half the cases, and they typically begin with autonomic symptoms, some vomiting, pallor, flushing of the face, cardiorespiratory changes, maybe some tachycardia, maybe some incontinence with it. And they can progress to having impaired consciousness, head or eye deviation, and occasionally hemiconvulsive activity involving one side of the body or generalized tonic-clonic activity. Most of these seizures tend to occur during sleep or upon wakefulness. The mechanism of the disease associated with SeLEAS is believed to be a benign age-related idiopathic focal epilepsy of childhood, characterized by a transient susceptibility of an immature brain to generate epileptic discharge that preferentially tend to activate the autonomic networks of the brain. The pathophysiology is not linked to a specific cortical region like what we see with self-limited epilepsy with centrotemporal spikes, or what people call benign Rolandic epilepsy, which I have another video for. But instead here, the interictal EEGs show epileptiform discharges in a multifocal distribution, often with an occipital predominance in the back, but they can also shift to other regions. And this sort of reflects that there's a diffuse cortical hyperexcitability in the brain rather than an abnormality at a fixed focal epileptogenic region. The seizures, or the on EEG, or the ictal epileptiform discharges, regardless of their cortical region, are thought to propagate toward the central autonomic regulatory structures, things like the insular cortex, the amygdala, the hypothalamus. And this leads to those prominent autonomic symptoms that we see with patients in this condition: the vomiting, the pallor, the cardiorespiratory changes, and these that define the syndrome. This selective vulnerability of the autonomic networks is what is unique to childhood and diminishes with brain maturation, and that helps explain the self-limited nature that we see in this condition. Genetic predisposition is suggested by the frequent family history of febrile seizures, epilepsy, and migraines, but there hasn't been a specific gene that's been identified for this condition. And there's no evidence of structural brain abnormalities or metabolic derangements that are associated with SeLEAS, or what we call Panayiotopoulos syndrome. Despite the dramatic and sometimes lengthy seizures that can be associated with this condition, it's generally considered a benign condition. Autonomic status epilepticus can be common, but it rarely results in neurologic sequelae, and cardiorespiratory arrest has been rarely reported. Most children have neurodevelopment and normal intellectual function with this condition, but some mild cognitive and behavioral comorbidities have been identified. Issues related to internal behavioral problems, mild academic achievement, underachievement, and so forth. The overall prognosis, though, is pretty good, with most children experiencing only a few seizures and no long-term sequelae from having this epilepsy condition. Children generally live normal lives, and the seizures self-resolve within 1 to 2 years after the seizure onset, and there is no increased risk of epilepsy into adulthood with children that have this condition. Education and reassurance are the mainstays. Most children don't require prophylactic anti-seizure medications when they have this condition, although you may want to consider treatment if you have very frequent seizures. Acute seizures can be treated with a low-dose benzodiazepine medication as a rescue therapy to avoid these seizures from becoming prolonged. In terms of maintenance therapies that have been studied, levetiracetam or Keppra has shown some efficacy in some cases. Valproic acid has been shown to be a little bit less effective in certain cohort or case control studies, but these are based on limited data. Aggressive or unnecessary polytherapy has the risk of increasing morbidity, particularly with the side effects related to these medications, and is generally discouraged, particularly if you don't have that many seizures. However, if you do have a lot of seizures, you do want to be able to consider treatment with it. Panayiotopoulos syndrome or SeLEAS is commonly misdiagnosed in times as encephalitis, syncope, migraine, sleep disorders, or gastroenteritis because of the autonomic features associated with it. The occipital spikes on the EEG may confuse it with another condition, idiopathic childhood epilepsy of Gestalt, which has a different prognosis and management, which we'll talk about in a different video. As with all my videos, please bear in mind, this is medical education. This is not medical advice. If you need specific medical advice, I would talk to the clinician that you have or seek an individual clinician who is going to listen to your situation directly and provide official medical advice and counsel. This is just for medical education. So I hope you enjoyed this video. If you did and are watching this on YouTube, liking this video and subscribing to the channel would be greatly appreciated. If you're viewing this in Nostr, a follow would be greatly appreciated with a like to the video as well. I hope you have a great day.